So we're going from requiring very substantial support to requiring substantial support to requiring support. Kids with the level 1 autism struggle the most with the post-school outcomes. What I mean by that is
So give me kind of your thoughts, and we can go over just the different severity levels for autism.
yes, absolutely. So one of the big difference with the DSM-5, right? Because before DSM-5, we have DSM-4. Remember those who live in the DSM-4 era, and we remember the PDD-NOS, and we remember the term Asperger syndrome, and those are in DSM-5, you will not see those terminology. One of the big change in DSM-5 is recognize that autism is a continuum, and once the doctor say, well, this child is on the spectrum, the doctor will also tell you the level of severity. It's a level 1, level 2, and a level 3. So earlier I talked a little bit about the doctor look at a couple of checklists. One of them is a social communication deficit to see whether your child have some behavior under all 3 areas, the social communication, the social emotional reciprocity, and the nonverbal communication, and ability to make sustained friendship. Now, the next area, which is part of the diagnostic criteria, is the restrictive repetitive behavior. DSM-5 has 4 categories. In order to receive the diagnosis, you only have to meet 2, but for social communication, you have to meet all 3, right? So some of the example of restrictive repetitive behavior is repetitive movement, and we see kiddos sometimes like this, we call it motor mannerism. And we also see kids, it's so important to have the same routine every day, right? Like we're gonna line up the little dolls, we're gonna line up Peppa Pigs, and when we go for a walk, this is the route we take. And when we drive to school, we have to drive that way. This is the inflexibility, I saw, Michael, you're nodding your head. I'm sure in your career you've seen many kiddos have this problem of, want things to be the same. And then also the highly restricted and fixated interest, right? And this is, I mentioned, maps, the cities, the numbers. They know a lot about that subject, right? And I have a student who knows a lot about FBI, and you can ask her any question about FBI, and she can give you an answer. And then also the sensory processing differences. I think many parents have seen those, and kids love this being squeezed, right? The hypo reactivity to the sensory input versus the hypo reactivity. One wants more, one wants less. And you can spend a child on a swing for a long time. You and I would be like, oh my gosh, I feel so dizzy. But for that child, it's so happy and give me more spinning. So these are the restrictive, repetitive behavior under the diagnostic criteria. Now, when we talk about severity of autism, we're talking about the extent to which kids have been impacted by these symptoms. So, first, let's talk about level 3. So, when we say level 3, these are kids have a lot of times they don't have any spoken language, they rely on a C device. We see a lot of restrictive behavior, and then if you change a routine or look at a major meltdown or aggression, how the child is impacted by autism is so significant. We require 24/7 support. Let me give you an example for parents who are listening to this podcast. So I used to work with a kiddo that has a level 3 autism who can only say, actually, Potty, that's the sign language he uses really well. And he can say the word for more, right? Those are the 2 functional, we consider functional communication. He has his iPad, but he mainly uses it as stimming tool. He will hit the same button over and over again. So the communication device is not functional. It's used as again, the repetitive movement, hit the button over and over again. And safety is a concern. We have to go for a walk every day, no matter it's rain or snow. That's the routine. And we cannot change the routine. And I saw one of the parents of a parent with a very young child post a sippy cup on the Facebook. Is because the child only drink that kind of sippy cup. So if you change the cup, the child is not drinking water. So you can imagine this little child hasn't drinking anything for a long time because mom dad could not find the same cup. This is severe, right? This is we cannot really adapt, adjust to the changes in the environment. And with this level of severity, we're looking at very substantial support. This would be the exact word you will see in your doctor's evaluation. And the second level is requiring substantial support. These children they can speak simple sentences. They still have that restrictive, repetitive behavior, and they are stressed out when there is change in their routine. The level one is requiring support. Okay, so we're going from requiring very substantial support to requiring substantial support to requiring support. These are kiddos who don't really have intellectual disability. They may be passionate about a topic, a book or subject, and then they still have trouble sustain that relationship. Actually, one of important research we have found recently is kids with the level 1 autism struggle the most with the post-school outcomes. So what I mean by that is if we're looking at employment outcome, right? Kids with a level 1 autism are kids who are supposed to work, they are able to work, but with the support they receive, a lot of them are sitting, at home playing video games and 8 hours a day. They do not have a job, even though they should be able working at a Publix or Walmart or, go to college and find a job. A lot of them have actually gone to college and they still cannot find a job. The reason why is because when you have a level 1 autism, it looks like you are fine. You can talk and you can read and you can drive yourself. And so it's under the impression that these kiddos don't need any support. Well, they need support in time management, they need support in executive function. And because they manifest themselves as, they're fine, we're not providing support they need. And this also is very prevalent in their friendship in middle school and high school. And if a kid's with level 3 autism, friends around them, they can tell this child struggle, right? And the child is not talking, they have AC device, they have the repetitive mannerism. You can tell this child has disability. And kids tend to be very compassionate when they see kids with the level 3 autism, level 2 autism. They want to be their friend, they want to be helpful, and they are compassionate. But with kids with level 1 autism, kids can be very mean, right? And they do not get it that this kid have autism. Their little mind is like he just try to be naughty and he just weird, he's quirky, and he just kind of obnoxious because he talk about the same thing over and over again. He does not have personal boundaries. Kids are less compassionate and then they are less forgiving. So, no matter where you are, level 3, level 2, level 1, regardless the severity, kids with autism need help and the parents of children on the spectrum need help.
I love how you, of course, thinking about the levels. So I started before there were levels. So I think sometimes I'll see on Facebook and, kind of, so there'll be frustration on, oh, your kid's this level, my kid's this level, you have it easier. We didn't even have levels until a little bit recent. So it's a newer thing. And it's still a checklist diagnosis. So just because your kid is diagnosed level 3, if they get early treatment, they may end up being to the point where they could be level 1. So it's not a permanent aspect. But something that I do think is important to mention, just if you have a kid who gets diagnosed, the level 1s don't have it easier, or the level 2s or the level 3. They're all hard. They all have separate challenges that are there for them. I think you especially highlighted, especially the kids at level 1, sometimes they get the, "Oh, you just have a little bit of autism," but it's still a challenge because they still have to navigate all the rules of culture, society, at where some of the level 3 kids, it's not expected for them to kind of follow the rules. So yeah, I think it's an important conversation to be had. So definitely not comparing your child to someone else's child, because they all, for someone as a clinician side, they're different challenges, completely different. But working with a level 1 kid presents me a different set of difficult challenges, just like a level 3 kid and a level 2 kid that's in the middle. So I think that's important. And I'm kind of glad that you mentioned that. So whether you are not sure if something is going on with your kiddo, whether you just got a diagnosis, or whether you're just kind of on a wait list, we here are very anti wait list. Waiting for so long to get help could be very demoralizing. So we'll start to talk a little about kind of red flags. And so I'll list a couple of red flags. Thanks for watching. Are you ready for support? Look in the description below to book a free consultation call. We also have free downloadables from Parent Empowerment Coaching and our quest to help parents fight for 15 minutes. Stay empowered, stay informed. We'll talk again soon.